So I was trying to do is find out at city council, and this is the page.
We're on our way.
You are on.
Are we on?
You still have a sentence to go though.
Okay, I'm good with that. That works for me.
Wake up.
Okay, we'll call this meeting to order and start with the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, and indivisible, with liberty and justice for all.
I didn't forget my sheet this time. Committee member Horton let us know he'd be absent. Committee member Grants.
Here.
Committee member Knowles.
Here.
Committee member Jones. Here. Committee member Schumacher.
Here.
Vice Chair Dalton.
Here.
And Chair Ray.
Here. Next on the agenda, I have the approval of the minutes. Is there a motion to approve the minutes from the June meeting?
I move to approve.
Do we have a second?
I'll second.
All those in favor say aye.
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 Any opposed? Thank you.
And then let's jump right into community partner presentations, Family Assistance and Resource Center. If you want to come up, is her mic already on? Okay, perfect. Introduce yourself, and then let us know what you're talking about.
Okay. Hi, I'm Candace Sturman. I am the new-ish executive director of FAC. FAC is easier, guys. Our name's long. So I was asked to come give a brief update on kind of what we're doing and how things are going. I went with Jason Ogden and we got to do a presentation at the 2025 National Conference on Ending Homelessness. We had a 45-minute presentation there. It was pretty good crowd. And then afterwards it was neat because I had about 40 people within a couple of hours calling me or emailing me and messaging on the app they use, asking us questions and how the city and FAC worked together. It was an amazing experience for us. So our shelter, we have recently added the 13 dual occupancy pods, as well as 2 pods that hold 4 people. We are transitioning people into there. It's been a fun, busy work in progress. They came and I had just barely started. Actually, I think my first day as executive director was the first meeting we had about them. And so I felt like we kind of just went 0 to 1,000,000. They're beautiful. My goal is to start setting small groups, and I say small groups for a reason, to protect the privacy of our folks there, but allow small groups to come in, kind of see what we're doing and how we're moving forward. Just because it's kind of an interesting concept that not many other places have, where we're starting with, you come in as you are, and we are helping you move forward. And as you progress, you get to progress where you're at in the site. So you kind of go from the huts, which we jokingly call a glorified tent, and then you get to progress into the pods. And they have heat and windows and electricity. So that has been really fun. I will tell you, my staff, as well as a couple of clients, we were getting paint together and all the things for the pods, and they said, we want to help. And I was like, okay, sign a waiver. Sorry, guys, I did. So it's not because they volunteered, but I wanted to make sure that the residents knew it was a volunteer. You're not guaranteed anything. It's not required. And I mean, in no time, they busted it out. So it's fun when I go look in the pods and I see like, oh, look, the paint's not, you know what I mean? You can tell it was amateurs. And I think to me, that makes it just that more special. So we've had a lot of really neat conversations with other communities about what we're doing, especially with that continuum. And okay, my big goal is, I know it's on record, but big goal is that at some point we can also have a rental assistance program where we start helping people. You pay a little amount a month and you learn, right? Because a lot of folks just don't know how to do it. So you learn, hey, I have to budget. This is how much I have to pay. And we save that money for them. We help be a rental reference and help them move forward. So it's one of the big, that's in my dreams. But hopefully here soon. A success that I really wanted to discuss, and if I get a little emotional, guys, you'll have to excuse me. We had a man and his wife, okay, long-term spouses. They had been homeless for 17 plus years, bounced various states, right? Just something happened to each of them separately. They met on the streets and just couldn't get that traction to get housed. So they moved somewhere else thinking it'd work, and that didn't work. And that's just what it's been for all these years. They moved into our shelter 7 months ago, and we started working with them. I mean, and they came in and they were, they'll tell you actually, he says, I was feral. Right. So just not used to having to answer to anyone because you're living on the streets, not used to cleaning up after himself, medications, any of that stuff. So that was a testament to my amazing staff and how hard they worked with him and helped them learn and filing for disability and all the things that they needed. And they didn't know how. I mean, he was working on about a 4th grade age level. So helping with all these things. About 2.5, 3 months after they moved in, a young woman moved in. She had been in the foster care system. It did not go well for her. She is developmentally disability, has some pretty big diagnoses. She came in, we scooped her up and we're helping her out and get her moved in, and it was later in the evening. The next morning, we hear just hooting and hollering in the common room, and that couple, the woman, is actually the mom that had her as a teen and put her up. She ended up going into the foster care system and they reconnected right there. We were a little concerned, right? Little cautious because that could go a lot of ways and not all of them pretty. And so we helped with the counseling and getting all the things in place for them. So all of this cluster and crazy and heartbreak, we got them housed 3 weeks ago. They are all 3 in their own apartment with income. We helped the young lady get a job, so part-time job, but it's something that's helping her grow within herself. And we are continuing to do outside case management with them. So that's my happy, and I'm going to carry that for the rest of my life. My team did amazing with that. So that was a really cool thing. I will say that we have some struggles, right? We have some, I mean, I'm just transparent. We have some struggles, not everybody likes to follow policy and think they're kind of, well, a lot of choice words, but they're not necessary, to put it in the nice way versus how I hear it. So we are working on helping our clients right now understand, like, they're not there because we're trying to be mean or bossy. They're there because we have, the state telling us what we have to do, but also it's to protect you and everybody else. So we're dealing with some of that, as is always, but for the most part, things are going pretty well. We had another opportunity We are expanding out our outreach and harm reduction. We got a call about a gentleman that had been housed about a year prior, and he had spent 20 some odd years unhoused, kind of a recluse. And we got a call that he was getting ready to be evicted. We got a call on a Wednesday. They said, because it's a low income housing, if he can't pass this next inspection, state required inspection on Monday, he's gone, because they had already extended it out, and so my team went out there, and along with Sean Morgan and Jess, I believe is her name. Huh? Jennifer. I was so close. Sorry. I've only met her once, guys. But they went over there and helped scrub this house, which was he was struggling. We'll just say he was struggling. So they helped clean the house. We've met with him twice since then and helped with case management, and we're getting him further resources put in place to prevent him coming to the shelter. So those are kind of our, it's what we're doing, and it looks like we may be working with this property management company some more on our outreach and harm reduction, where we can do things like that to help with preventing people from becoming unhoused. So I don't know what all I was supposed to say.
I have a question.
I have answers.
So you mentioned like case management and other services that your staff are able to offer. Is that only for people who are like currently like residents at your guys' facility, or are you able to help people? Like, is there a referral process if there's someone homeless in the area?
Yeah, I would say without a doubt, anybody can call our shelter or send an email. My email address is the one hooked up to our website. I can give you the email address as well. Or you can have my cell phone number. I got one the other day in the middle of the night, and we help. So yes, we will help anybody that wants our help. And we have options. So folks can can schedule a time with one of our case managers, come to our shelter, and we will help with whatever they need. They may or may not be able to stay, right? Because we don't have 100 houses. And not everybody has the capability to stay, unfortunately, because we are behavior-based. But or we can go to them on outreach. Right now, our primary days in Sweet Home for Outreach are Wednesday. They go to the police station every Wednesday at, oh my gosh, I don't do the outreach. I think it's 8 a.m. Cecily, you're not helping me. Where's Sean? I believe it's 8 a.m. when they go. And my goal is to expand that out. We're slowly but quickly growing. So our goal is to have 3 to 5 days a week that we are doing the outreach.
So a question, obviously, you have support services.
Mhm.
How many do you have currently, I guess, is a question, because there's a lot of support services out there.
Mhm.
And I don't know how you go about identifying them. The reason I ask is, and I want your name and your information, because this group does the health fair that's coming up next month on the 16th. And right now I've got 32 different vendors that are coming, they're service providers.
Yeah.
And I'm thinking this is your opportunity to plug into a huge group of service providers, but I'd like to get you invited there, because I know there was a change of leadership and I wasn't sure who I needed to talk to. So
no, I'd love to go. I actually went last year with Stars to the fair.
That's right.
Yeah. I was there last year. So the way we typically connect with them, I guess I will say that I'm blessed in the fact that I've been in this field in some way, shape, or form for over 16 years. So, right? Yes, my son is almost 17, so over 16 years. So I know a lot of people we have staff, especially we've hired some new staff that has been in the field for a really long time, and we all have our kind of backdoor connections. You know what I mean?
Networking.
And it's great. We're
Yeah.
really blessed with that. One of the ladies that we just recently hired is a housing supportive services navigator. She did that for years. So she really comes in with that housing specialist mind, state of mind. And we go when I can. I didn't get to today, but I do the Lynn County Shelter Summit shelter meeting. Yeah, I don't know. I do a lot of meetings with all the people most of the time.
Well, that's good.
I would like to say
One
more.
other question. I mean, obviously you have to have financial stability.
Yeah.
And with what's happening in our country, our leadership in the state of Oregon and budgets, do you see that coming back and impacting what you're trying to do? It's a loaded question.
I was like, geez,
It's a tough one because I see SNAP and all these other groups that are gonna get impacted by these budget cuts, and it's a big one. I just read here Medicaid is a big one. And they're
Yeah,
talking a
and-
shortage of up to $10 billion. And I go like,
Yeah.
wow.
well, and we have right this second, I can tell you the biggest impact that we are seeing already being implemented, and it's going to get worse, is Oregon Food Bank.
Mhm.
Our food share orders, everybody's food share orders have greatly dwindled. And I think for us specifically, it's a little more difficult because we don't currently have a kitchen. So, so if anybody, wants to build a food truck and let us have it. But so we don't have a kitchen. So everything we get is shelf stable, right? So I'm glad that our clients love chili because they get a lot of that. But so that is an impact we're already seeing. We have been really fortunate in getting grants from Oregon Health Authority and OHCS, Oregon Housing Services, some OHCS guys. I don't know. It's been a long day, sorry. But OHCS has been great. They really worked with us. We got a really big shelter operations grant. And I'll tell you the best thing about that grant is it's not so narrow focused. It's anything that we need to have our shelter running. And we did just find out the end of June. It was supposed to have ended, and we did get a recertification, and so we know comfortably that it's a 2-year thing that we know comfortably right now. Comfortably. So
Good.
outside of that, if you guys start seeing a lot of FAC fundraisers, please participate. I mean, it's unfortunately, wherever you sit on the spectrum, right? There's a lot of change going, and some of it will have a greater impact on us as an organization, but we're seeing some of the impact for our clients. So the SNAP benefits thing, right? Looking for work and doing all of that. Well, we have people that are disabled. The majority of our residents are disabled. And I don't mean, oh, you have depression disabled. I mean, you have crippling depression so bad that medication's not working. You can't leave the hut. Okay. So it's not a small side of disability. And so they use, the Medicaid and the SNAP benefits. And while they're trying to apply for this very long process of getting disability or general assistance to do this. And so there's some concern on what that's going to do for them. And the long wait list, I can tell you I have a staff member right now that is debating on quitting because she does not have her and her husband, he is on disability, but he can't his disability prohibits him from watching the kids. Okay, so she can't get daycare assistance right now, so she doesn't have support in that. That's not the case when they had the kids, but it's the case now, right? So she's debating on having to quit and be a stay-at-home mom somehow, or find somewhere she can take her kids with her. So is
No.
my answer to your question.
No, I mean, it's just a challenge. I can see it for all the groups out there. I mean, especially for the services you're providing. Hospitals, the same thing.
Oh, yeah.
What's coming down the pike to them is looking at how that's going to impact them, the Medicaid issue. And so I just see that being a chain reaction for all of the above.
Yeah, I
Yeah.
mean, majority of our clients would not have, when all this Medicaid stuff trickles down, they won't have any insurance.
Yeah.
You know, and when you're unhoused or unstably housed, medical care is difficult anyways, and now add to it, you don't have insurance.
Yeah.
I'm really scared for our people with that.
Thank you.
Yeah.
Thank you for what you do.
Oh, yeah. Right now I'm paper pushing, so it's
And-
great.
Candace, could I ask how many staff do you have?
We have, hold on, because we just had some change in staff, so I have to recount. We are at 7 right now.
Yeah, good.
We just hired our manager left. She had another job opportunity. So I just today announced we hired a new manager. And we have a new supervisor coming in. So we will officially be at 9 as of next Friday.
Very good.
Sorry, that's good news, guys. Yeah. And we also utilize a security company at night. So that saves us on having 2 more employees.
Hmm.
Forgot to say that.
Any other questions for FAC?
Good job.
Yes,
Thank you.
thank you for all you do. Yeah, I don't want to
Yes.
keep you. I know you have another meeting.
Yes.
Yeah.
Right.
Thank
Sorry,
you
guys,
for
I got a
coming.
911 foster care meeting that I have to attend for my foster sons. So that's the only reason why I can't stay today. Thank you. I don't have a card with me. I can. Cecily's got us.
She'll connect.
Uh-huh. Yeah.
Thank you so much.
Thanks,
Yes,
Candace.
thank you, guys.
Thank you. And then next is recognition of visitors' public comment. Is there anyone online? Okay, moving on. Old business, health forum.
You get a smile on your face. You're tightening it up. What's the deal?
Well,
I don't-
is there a decision on what the health forum is going to be about? Have we thought about what presenters we would want or experts to come speak on the health topic? Do we know what the health topic is? I know we have a date and I know we have space. Those are things I know.
I'll step out there on this one. As a group, I don't think, we need to come together and decide what that is, and we haven't done that yet.
Okay.
I mean, we come to these meetings, but I think it's either a work time that we come together and that's what we focus on, and I think that's probably the best way to do it versus try to do it here at a meeting like this. But I mean, what's your thoughts on that, Cicely? Because
That is totally up to you. I mean, I certainly am not opposed if you want to have a full discussion on what that looks like, but if you wanted to schedule a dedicated work session for that, that's an option as well.
I mean, it's a flip of a coin. I mean, we could pull something out of the air. I mean, I think we haven't had anything in front of us to really drill down to say these are our top 5 priorities, and maybe that's where we start. Is each of us go away from a meeting like this and in our own mind come up with the 5 top topics we feel that we want to address and get that amongst us, and then we can come back and
Do we have the
Well-
list, or does Larry possibly have the list or have access to the list that was discussed in the focus groups that Western University did that the residents of Sweet Home said were things they wanted focused on.
Was that part of the presentation
Yeah.
from then yes.
Okay.
Yeah, we have that in a prior packet, I'm pretty sure. And if not, I definitely have a copy somewhere.
Could we,
And I
Yeah.
have his presentation at home.
Okay.
if we can get that, I think that would be helpful because that's something that the community members came together and said, this is health wise for us, what our biggest needs are. So I think if we start from that list, it's a good place to start rather than maybe some of us
Brainstorming.
brainstorming like, oh, this is health that's important to me personally. So I think if we could get that list, could that list be sent out prior to our next?
Oh,
meeting
yeah.
So that we can like look, not discuss it,
Yeah.
not reply all to any emails,
Exactly.
but look at it.
Who told you that?
I keep
But
seeing
look
that.
at it and just start brainstorming
Yeah.
and maybe, oh, I know someone, so I'm gonna bring it up at the meeting, like I have an
Yes.
expert for this and this is, okay.
Yeah, I put it on my to-do list to find the copy, so I'll just send it out as soon as I find it.
Anything else? I mean, I don't, until we have like a topic, I don't think there's much we can discuss on the health forum. I just want to make sure it was on the agenda. So the fact that we need a topic was discussed. So anything else from anyone on the health forum?
Good idea.
Okay, health fair update. Bob, take it away.
Uh-huh.
What would you like to know?
It's
Actually-
Wednesday,
actually-
Wednesday. I know recently someone included CC'd me in an email for like a late application.
Got it.
Okay, perfect. I just want to make
They-
sure.
In fact,
I couldn't open it. I assumed they gave you the access to view it, so I was.
I got that same application and this thing will not let me open. I tried all kinds of things. So finally I said, I just emailed him back and said, I'm going to take your email as your application, and put it down. So, but anyway, I have a list of the providers we have. We have 32 signed up so far. Yes. And if FAC comes on, there'll be another one. So that's about 36 tables. And I'll just let you guys have these and pass them around. That'll give you an idea of the groups we have.
If there's something that's not on the list that sticks out to anyone, let us know. Cause I
Thank you.
would just hate to miss an opportunity to have everyone that's providing or able to provide, not necessarily in Sweet Home, but is able to provide services to community members in Sweet Home, these services. So
I mean,
I'd
it's
love to have
it's a
everyone
pretty
there.
good list.
Yeah.
We've got some new ones that are coming this year that we haven't had before, ones that it's been a while since they've been here. So everyone's really expressed being excited about being back here and having this event again. Like I said, I picked up some, Mr. Knowles has reached out and had some like the Young Roots of Oregon, that group that I hadn't had before that are coming. So yeah, if you know of others, I posted this. I sent this to the Chamber of Commerce to get it out on the site. I sent it to Cicely. If she wants to post it, I see there's already a bid in the website there for the city that's already listed it. I went down yesterday, a flyer that I had composed, and I had it blown up bigger at the Tell and Sell. She did that for me. So those will be going out in the community. And I just started today actually sending the flyer back to everyone that's sent an application to me to
Good.
post it on their website so you can get the word out. So that's something I did do last year. So I thought that'd be a good ad to get it out to those that want to share that. So probably the biggest thing that I'll need help with is the setup and getting to the tables. My back, I recently messed it up and I'm babying this guy. So
Dr. Horton asked me to let you know that he will have a bunch of trucks and volunteers for you at 7 a.m.
that's good. But other than that, it's going well. I'm excited. I have 3 new banners that Cicely helped me acquire. And my question to this group is, where do you think they're best located? Now, I had one idea is at the old clinic on Main Street.
Mhm.
I thought that's right, that 4-way intersection. What a better place to stick one up in the bark dust up off the road a ways. I don't think ODOT will jump me, but
If Thriftway.
I guess I could
does
beg
that-
I
for
was gonna
forgiveness.
say, ask forgiveness, not.
I'll just ask
but-
forgiveness later, but I thought that was a good location to put one up because a lot of people see that. I always put the huge one on the fence by Thriftway, so
Right.
it's a big eye catcher as well. One I'd like to reserve probably just for the health fair itself, right on Long Street the day of. And then that leaves one other. So I didn't know. Well, the other
Could
place
one
I
be put
thought,
up here?
what's that?
Could one be put up here?
It could be. I thought the other place that was kind of to me an eye catcher is in front of the
can't
police
be-
station. I was thinking in front of the police station is having there because you catch the Bimart group, you catch the McDonald's group, and anyone that's pretty busy right there. So I thought that might not be another place that might be a good.
Yeah,
place.
if you want to put that in an email, I can see if we could mount it in the front right there outside
Okay,
on
we'll
20.
do that.
The other option that you may consider is there are 2 T-posts already driven into the ground coming into Sweet Home as soon as you get through the Narrows, but right before the city limit sign.
Is that the one that's got a banner on it right now, or did have?
It did, but I don't believe there's anything on it, but
I'll check it out.
everybody coming into town drives by that, and it's the only thing there, so your eye goes right to it.
Yeah, I'll check that out.
Yeah.
Or I can put it in the back of my pickup, drive up and down the street like a flag, like most people do, so. Probably get rocks thrown at me.
Is something on the reader board, or could it get put on the reader board?
Oh yeah, we can definitely add that.
I'm sure he can do it.
Okay. And you already answered my question about setup, so.
Yeah, I think we're good.
Can you send us the flyer?
I will do that tonight.
All of us. We can pass.
I was
it-
gonna bring him, but I didn't.
Well, we can pass it around.
All right, we'll do.
Yeah, having an electronic copy would be nice, as
Yeah.
well as because I know the
I know I sent her one already.
the old one. So
Okay.
sometimes it's hard to scan those and send it electronically.
Yeah.
Anything else about the health fair before we move on?
I think
Nope.
that should do it.
Just was wondering, did you ever get the one from Senior Center?
No,
'Cause she said she sent it out.
maybe I did. If it's not on this, if it's not on this list, then I'd say, no, I didn't get it. But I'll go back and look through. I've got so many emails and back and forth between providers. Either that or I'll just pencil it on my list and say you'll be there with a table. How's that?
Yeah, they're gonna
I'll
have a
just-
bus there and they're gonna,
Now, the bus, I'm planning on that there, so maybe that's part of this in here somewhere.
yeah,
So
I don't see them on the list. I'm just a little nervous for them.
I wouldn't be a bit surprised I missed it.
All right. So I'll just.
It's on my list now.
Some penning it in.
Trying to keep that in my mind on that one, so.
And
You need 7 tables?
Seven? One.
I put one table and bus.
Just
Oh,
one.
man.
I'll put you down for one for
All right,
sure.
thank you.
Okay. Anything else? Moving on. New business, crisis intervention / postvention. I think you brought this up.
Well, the one
I
I,
did- I did.
Wanted
You
to.
no, you actually asked to place it on the agenda.
But after it was
I-
brought up, I said, let's do this
And
next time.
I was going to just subtly say, when I brought it up, I thought I was talking about conflict resolution. And by the end of the conversation, it had switched to crisis intervention. And I love the post-intervention, that's perfect. But to my mind, they're still 2 different things. And my emphasis was this whole political stuff that we've got going on, not just nationally, but in this community. And I was hoping to find some way to, even back to the health forum kind of idea, having someone come in and help us figure out how to talk to one another without throwing rocks and threatening lives and things that have been going on. So that had been my initial thought. Like I say, that crisis intervention is fine. It just, my thought was conflict.
that's a tough one.
Yeah.
I mean, it's to me, it's kind of sad that we're at that point in our country and our communities that we have to be reminded to respect one another's opinion, even though we may have a difference of opinion. But the commonality is that we want to resolve a problem and that we just sometimes can't get there. And I know exactly what you're talking about.
Well, sometimes the very basis of those kinds of discussions start with just acknowledging that that's going on.
Yeah.
Because what happens is you build such a big wall, I'm on this side, you're on this side, and that's, you can be living next to somebody and you just don't talk to them. But if you get to the point where you can acknowledge separate issue, let's go to the store together, do whatever. And that's generally a start.
And can you remind me, did it come up in relation to school age, or you're just talking in general through the whole community?
Well, mine had come from internally within the community. Previous position, yours, and stuff like that has gone on. The school issue came in to it. And then I'm remembering I kind of mentioned that that's actually where you want to start. Resolution of conflict, if you're 8, is a lot easier than when you're 40. So, I mean, you can actually do those things together. You probably wouldn't want a bunch of 8-year-olds in a health forum with the rest of us, but you also probably wouldn't want those 40-year-olds sitting around with an 8-year-old group. So,
No.
but you could do them together.
Yeah.
Or separately, rather, at the same time. But thanks for asking for that, because that has come up. People get zeroed in on one thing. It's probably easier to do it with the kids because they're there and you have a captured audience, pardon the expression.
They're more willing participants.
And they almost always like doing it. Not true of the 40-year-olds.
That's a that's a very multi-level task you're asking, Dick.
Yeah.
I mean, my wife went, I think she went to one of the clinics or something, and there was actually a poster in there how you should behave. And she asked the nurses, really, you have to post that? I said, yes, I do. You know, just to think of a patient lashing out and misbehaving. And school district, we see the same thing. I mean, we see it in the paper about how even our own city government operates. You know, I'm thinking it's in the paper. How many times it has to be in the paper for you guys get it, you know, that you don't need to be doing that. It's tough. I don't know if it's something that you start at the very beginning of the meeting, says, here's how we'll conduct ourselves during this meeting. But yeah, I don't know how you do it, Dick. I really don't.
Well, we just had a presentation from Candace, who spends a lot of time with conflict resolution, and they do it. They work on it.
Yeah.
They train their staff. Staff spends 24 hours a day thinking about it. It's just the rest of us don't like to think of ourselves as, you know, I do exactly the same thing as they do at the FAC group. I mean, this is nuts. But, you know, yeah, I'm not diminishing or lessening how difficult it is. But it just feels like I'd like to get started. You know, there probably people, well, I know there are people in the Samaritan group that kind of see themselves as able to do this, mental health as people. But to actually come out and do a forum type of thing or a larger group, that's a little difficult.
Oh. And my wife, as a school teacher, she went through a lot of that with parents.
Yep.
You know, it was just, she'd come home stressed out, and she'd tell me these stories about just parent-teacher conferences, and where they really went south a lot of times. It took a lot of time. But I don't know if I have the good answer for you, Dick, on
Well,
that one.
I'm working on it too. I'm trying to gather people at mental health, somebody volunteer to do it, or
I'm still learning after 51 years of marriage. What are you talking about? Still working on that one. So it's a work in progress.
Well, and I would say, at least in the medical field, you're talking about trauma-informed care. And, everyone comes from their own place. And sometimes their responses and reactions are based on where they're coming from. And so it is an extremely challenging issue. Does that mean we can't work on it? No, but it would, I think breaking it down to addressing some of that, because many times there's a lot bigger issues underneath.
I love doing this because, I do the whole healthcare stuff too, and trauma-informed care is just, I mean, it's everywhere, except at Safeway, except at Bimart, except that those folks who do not have those options just don't get it. And I think that's my point. You almost get to the point where it's us and them. I know about trauma-informed care and you don't. Well, you just missed the point. And I mean, we need to look in the mirror about this stuff. Those of us who, I mean, how many hours of training, quotes, have any of us got? And actually taken part and train people. But we're not talking to the bus driver. It's trauma-informed conflict resolution, that sort of stuff. So that's what I'd like to do, just kind of blend it. That's why I think of it as a community thing. You don't have to get uppity about it. It's just, there's some things that have not gone well for this community. And both perspectives will acknowledge that, but they just tend not to try to say, well, maybe I could understand what you're doing.
So is the thought then, or the hope, to bring either like a trauma-informed care type class or something to the community and just offer it like for free? Someone could come on this night and this is what we're doing. Okay. Well, because I know there's definitely groups that do the mental health first aid for free for communities, the assist training and the trauma-informed care. And so I just want to know,
That's
like,
kind of
what
fun.
should we start looking into to
what
bring next
kind of-
time?
Bugging about this.
Yeah, I'll just keep the rest of the comments to myself, but I think that's a great idea to have it for the community. My concern would be some of the places that this could be really helpful, maybe not wanting to come or not realizing like they're the people who need to be here the most. So do we then extend an invitation to them from our committee and say, hey, we've brought this group here, this is what they're going to be doing, and we would really like you to participate? I mean, you can't make everyone want to be better, but I appreciate what we're trying to do. Anyways, anything else about crisis intervention or postvention? Okay, committee communication policy.
Speaking of.
All right.
Okay.
So this was brought up several months ago by this committee. So I got with the city manager and we put together an official policy. So this is actually going out to all of the committees, not just y'all. So it applies to everybody. I'm not going to read it because y'all are smart people and you can take it home. But basically, at the end of the day, the city manager, Jason Ogden, is the chief spokesperson. And so on the last page at the very end, you'll see some statements that we recommend you use if you're approached by a member of the media. If you want to comment as a private citizen, you are more than welcome to do so. We just ask that you please make it very clear to the reporter that you are speaking on behalf of yourself as a private citizen and not on behalf of the committee or the city. But if you ever have a question, don't hesitate to ask myself or Jason. And there is a little reminder in there, number 4, just about open records, social media, anything you do, even on your personal devices, if it relates to the city or city business, it is subject to being subpoenaed. So just keep that in mind and, always know that whatever you say or do can end up in the paper. So yeah, please take that home, review it. It's very basic. But again, I encourage you to use those statements on the last page if you do find yourself in a situation.
I truly appreciate
Yes,
this.
thank you for bringing it up. It was needed.
I think the verbiage is great.
Yeah,
Yeah.
it's well written. And it helps to have examples.
Yes.
Yes.
I'm still doing it, like yes, but there's always something.
Yeah.
People will often say, well, I do a lot of stuff for the city and and then they name all this stuff and I think, and well, okay, how close did you come to
Yes.
saying, I'm a member of,
Right.
and you just kind of have to teach people
Yeah.
not to do that.
Yeah.
Well, and I know this came about for me personally because someone did reach out to
Yeah.
me from a news source several times, several emails and phone calls, just asking questions about our meetings because our meetings are available online. And I answered the questions and then went, this feels weird. Why did I do that? I don't like that I did that. And immediately was like, help. So I'm grateful that it's now in writing and I can
Yes.
reference it. But what I was also hopeful for when I saw communication policy
But
was that we
What?
would talk about the emails thing, because it gets really
Yeah.
confusing when emails are being sent on behalf of a council member
Mm-hmm.
to us
Mhm.
wanting a response from us,
Mm-hmm.
but I'm also told that we're not allowed to do that. And I
Yeah.
feel like they should know we're not allowed to do that. And why are we
Sorry,
getting
we
that?
already talked about
No,
it.
I'm not mad at
No,
anyone
yeah,
for
no.
responding. Okay.
So first of all, no one is in
No one's
trouble.
lying.
It's all good.
who are we talking about?
I just think I think it was it's confusing how it gets written sometimes that like, oh, this person that's
Yeah.
a part of the committee would like a response to this. And then
Mhm.
because my gut reaction is to always like, I want to be the first to respond to an
Mhm.
email and like
Yeah.
follow up and not leave people hanging. But then except for when it comes to this, and then I'm like, oh God, no, please don't. Because I only say that because it has come up in like when we first started
Mhm.
and you weren't even with us at that time. Like, hey, there's new rules and there's new things you can't do and like don't reply all.
Mhm.
And I know that, yeah, I'm not mad at anyone for responding. I didn't respond because I have been told in the past not to respond. And so it seems to be a reoccurring thing. And then next thing you know, there's 40 emails and can we talk about that?
So what I would ask or suggest is whenever this happens, if I'm not on the thread, send it to me because especially in this
I
case,
appreciate you so much for always doing that.
because that's something that
Yeah.
I or Jason can address directly if it's coming from a counselor, for example, or if it's from another staff member or something like that. Keep in mind, none of us can direct any of you to do anything. So even if you feel like there's an expectation, that there is no expectation on you to be responsive, to provide that information. I think just for y'all's sake, if you send it to me, I can make sure that they're either getting what they need or they're getting a reminder about the rules or whatever is appropriate to that situation. But yeah, I would say when in doubt, never reply all. So just to be safe. And again, we just never want to be accused of potentially making decisions offline out of the public view. So, and obviously that is not what happened. And again, I'm not concerned with what happened, but going forward, yeah, if you just loop me in immediately, I can nip it in the bud.
Yeah, I was just hoping we could review that rule. Like you
Mhm.
cannot reply all, but then also more than how many of us can't have a conversation.
So there's a couple different rules. So if 4 of you are having a conversation, it constitutes a quorum. But then if you are in smaller groups and the conversation is held in various groups, that's considered a rolling meeting. So that basically you're splitting yourselves up to not achieve a quorum, but you're still getting a consensus outside of a public meeting. If that makes sense.
Does
So
that
it'd be
have to
like
do
if
with only committee related things?
yes.
What about the health?
I know. You guys are in a little bit of a weird thing with the health fair. What I would say is nothing you're doing for the health fair is ending up as a policy recommendation, a regulation recommendation. You're making event-based decisions, and your budget's already set. So it's not like you're voting offline to spend money you don't have. So I would not worry about those.
The
Yes, it's
extent of the conversations is Bob saying, hey, these are the people. Hey, that looks great. Oh, also, have we reached out to them? And then also doing the
Yes.
same with Dick. And so it's just, oh, are we allowed to do that?
Yes.
Or I
yeah, I would
don't
not.
want to get anyone in trouble. I'd rather
Yeah.
ask the questions than
Yeah,
be
don't
like,
don't
"Oh,
stress about the health fair stuff. Now, again, if you were wanting to potentially change the committee's mission, which would require a code change, then I would ask that you bring that forward and we
Okay.
put that on an agenda. But if it's just to do your operational stuff to make sure you have a successful health fair and you're not going to break your budget, then don't worry about it.
Okay. Does anyone else have any questions about that? Because I know it's come up before, so I just want to make sure.
How much time have you got?
I
Well,
don't-
and to me, it just feels like we should never have any conversations
Well, that's
individually
the
or
problem. That's exactly-
outside of the meeting.
well, as long as
honestly.
it's not relating to anything that we're discussing
Well,
within the committee,
right.
like
Mhm.
some of us are friends and
Yeah.
we have
And you're in the
similar-
industry.
Yeah.
Sure.
Yeah.
So,
I
but as
understand
long as
that,
it's
but I
not
mean
relating to
committee
like committee
business.
directly, yeah.
Yeah.
But if you want to send a message to the chair, like, hey, I'd like this on the agenda,
Mhm.
and you just
Right.
respond to me or send something to Cecily, that's absolutely
Totally
fine.
fine.
But sending it to everyone to then discuss is where
Correct.
It's
that was
about
my understanding
decisions.
of it.
Yeah.
Making
And so
decisions.
everyone on the committee knows that now, right?
I hope
Because it
so.
came from a committee member.
So,
Yeah.
well,
On
yeah.
behalf of the
So
council.
Counselor Bronson is not a committee member. He's your
No, but it
liaison.
Came from.
Yes. And so we will remind him.
Yeah.
And obviously he wanted and valued your perspective, which is totally appropriate. It just was unfortunate the way that.
I have another question, that actually, I guess it can wait because it's committee business for the good of the order and not. Anyways, anything else about the communication policy?
What's an email
So-
to forward?
We have,
What email do we forward things to you to in case we get stuff?
It's cpretty@sweethomeor.gov. So the email address where you received today's agenda packet, that's me.
So if we find some information on the net or something like that, is it okay if it's related to that, if we send it out to the members and not, for like an agenda item or whatever, but
Yeah,
just general information?
absolutely.
related to that?
Yeah, I encourage you guys to share resources with one another. It's just, again, if you're wanting to bring it up as an agenda item, please loop me in or loop Kelsey in. But yeah, no, absolutely. If you find an article or you discover a new service provider that you want people to be aware of, absolutely, you can send that to each other.
And Cecily is really great. And when in doubt, if you just send her an email
I'll
and be
send it
like,
to her.
am I allowed to do this?
That's what I'm learning.
Yeah. And I try to be
And I know
super
that I've done that.
responsive.
Um,
It's okay.
yeah. Okay. That was all I had about the communication.
Sure.
At this time. Okay, committee business for the good of the order. I have a question about the board liaisons and then the presentations that are given to the board. Like, do they, or not the board, the city council board, whatever. It's. Anyways, how often does the liaison like report back what we're working on, or like what does that look like?
So that's a great question. It really varies
thank you.
liaison to liaison.
Period.
Yep.
It's really at their discretion how much they choose to share or not share. I would say that if you have an expectation of certain information getting passed on to council, it's probably safer to tell me that, and I can have it included in the city manager's report. Just because sometimes, we go a few weeks and they forget, or sometimes they're not here, or sometimes it's been a long agenda and we're like, okay, we're just going to get out of here and we don't get a committee report. We do include the minutes in the packets. But again, it really varies from person to person how much they share about their committees.
Just a personal gripe and more just for your position, you personally, but your position. I've been going to city council meetings for a long time, and for the longest time, people were assigned to be liaisons to various things, like a lot of county things. And it was really quite helpful. I would used to go to those too. So I would sit next to the liaison, and it's just a way of making sure people know that Sweet Home's out there and that we're interested in. We need some county help. And all of a sudden that began to tail off. And at the council meetings, you'd hear more and more, no report, and it's like, I was there.
Yeah. So those liaisons, those are at the discretion of the mayor. So
Well,
the city manager's office does
No,
not do anything
my
with that.
point is, yeah, somehow that whole process has gotten kind of loopy. And it wasn't so much discretionary. It was, I'm assigning you, I want a report. So that's why I say it might be might be time to kind of bump the folks who are liaisons and maybe remind them that there may only be 2 or 3 community members, but Adam reminded me, folks listen afterwards. And
Yeah.
it's a good time to remind folks that there are hundreds of people thinking you don't even do that. You don't even go to those meetings. And it's kind of a subtle way of letting them know, yeah, I do what I'm assigned to do.
So that feedback, I would encourage you to share with your electeds, especially the mayor, because she is the one who, or the mayoral seat is the one who makes those appointments. And I can certainly pass that on to her as well on my meetings, but I'm just saying, I think stuff like that coming from constituents goes a lot farther than from staff sometimes.
I
So-
would recommend coffee with the mayor is a great time to bring that up. She's available every single Thursday.
3 to 4.
3 to 4 into the brew.
Coffee at 3 to 4?
They have decaf.
I'll be up all night. No, that's actually not even out of the norm for me. I'm just griping. What was I gonna say?
Is that, she does that here?
No, into the brew.
Into the brew.
Oh, at the brew.
Yeah,
In-
into the brew.
It's like right on the corner by
Into-
Chevron.
That's the one.
Okay. I keep
Yep.
meaning to go in there. It's so cute on the outside. I guess, I mean, I'll just ask because I feel like we're still pretty new and pretty green. What is the purpose of the liaison and like what, because obviously our liaison is not here. Do we get updates? Are we notified when they are and aren't going to be here? What is that?
Again, that varies from counselor to counselor.
Okay.
Some are more communicative, some are less communicative. The purpose is that ideally, yes, they'll be reporting back on committee business. I do think to some extent, sometimes folks feel like the inclusion of the minutes is enough.
Okay.
Some people don't. It's also, it varies committee to committee because, for example, Park and Tree Committee has a lot more events going on. So they tend to get more reports done just because there are more things to highlight. Whereas obviously for y'all, health fair is your big thing. And then whenever you do health forum, that will be a big announcement as well. But again, it really varies. And depending on who your liaison is and their personality and their involvement.
So when we decide to schedule the conflict resolution, we should just tell you.
Yes,
Okay.
please. Oh, yeah, absolutely.
Report.
Yeah.
Get attendance for that. Does anyone else have committee business for the good of the?
Well, back to Dick's point, though, I think when, as committee members, or even as the public, when you're chiming in on a city council meeting and you hear that we don't know reports, it really lends you to believe that nothing's being done with these committees, so why do you even have them? So to me, it's the support we need. I know there was times when I would come to a city council meeting and Lisa Gorley would ask me, Bob, do you want to report out? She'd ask me to report out on that, which was good. And like I said, I think that's kind of it's an opportunity, I guess, for those liaisons to show themselves in the public. It's like the health fair, this is our 8th year. And the only person I've ever seen come to the health fair was the mayor. And so it goes like, why am I busting to do this if they don't support us in our mission, So, I mean, that's an expectation. I think we as a group would like to see that.
Mhm.
And maybe we do voice that opinion,
Well, again, I think
I mean,
coming from you, that would be valuable.
I don't have a problem coming to the city council and just say, here's something I think is an opportunity for as members to increase your knowledge and participate, but let the public know that you're out there.
Yeah.
I mean, this last city council meeting we had where we talked about the fluoride, I sat back there and I was kind of disappointed how it unfolded because it was like we're at the 3rd reading and we're like oblivious to that. I don't know how we all missed it. At least I know I missed it. And I'm going like, part of our roles and responsibilities as a committee is to be connected and involved with health related issues. And, it never came across this desk.
Mhm.
And so it's like, wow, the mind was already made up and sealed and done, and I felt a little sorry for Ivan and Larry, presenting just because Larry had questions. Of course, they was quick to point out, we're not here to answer questions. And I got cut off and I thought, wow, it just kind of had a sting to it a little bit, you know, that here's a guy that really had a legit question, was how many of you have actually reached out and talked to healthcare professionals before you made this decision? The answer from the posturing I could see was it hadn't happened. So I thought, why are we not stepping back from this one and coming back to it? I mean, it's just a process.
Mhm.
It's an opportunity, I think, going forward that we can do a better job at that, you know, so. Very quiet. But I think it's both sides. We on our half have to extend that hand and sometimes educate the other half of what our needs are and how we can be a support to them. Because that's this health committee. It's a support to the leadership of our community and the community members themselves. I mean, I see that's our role. So, and it's a different one being a health committee. I mean, that one's a different take than the tree, you know, Parks and Trees. So. Don't mean to bring it down a notch, but
No.
Bob's dad.
Is it not possible if the liaison, if we go to a city council meeting and the liaison is not saying anything, can one of us present?
So you would have to be recognized by the chair, which is the mayor.
Right, so we'd have to
So-
sign in,
You would have to sign in ahead of the meeting.
right?
And typically the liaison doesn't speak until the end of the meeting, so you
Mhm.
wouldn't know by the time you were signing in if they were going to present or not.
Mhm.
You could nip it in the bud and you could absolutely sign in and go talk for your 3 minutes, and then that might spur them to
Well, or-
report at the end.
Or you can sign in under the committee report
Mhm.
section and wait until that section and see if something is presented or not. And then if it is, and you can just say, no, I don't need my time.
Yeah,
But I mean, that's totally up to you.
all right. I just was curious, because that would be another option if we're
Yeah.
feeling like we're not being represented, that we could discuss it among ourselves, who would come.
Yeah, I think the lack of representation concern comes from there was a health related need that was discussed at council more than once, and it wasn't brought to us until it seemed like it was almost too late. But I don't know because I haven't looked since the website was updated, because it's my understanding the website has been updated. But previously, if you look under the community health committee, it says that we will like help advise council on health related matters for the community of Sweet Home. So it just kind of feels like, okay, if they're not going to come to us to help advise them, what is our purpose and how are we being viewed as like a committee?
And to be fair to Ken, that's exactly his point
Yeah.
during the council meeting.
But anyways,
Yeah.
we can move on. Is there any other committee business for the good of the order? Okay, joint city council work session, August 26th. You want to talk on that?
Yes, so on August 26th at 5:30 here in Chambers, we're gonna have a joint work session with your committee and city council. Marty Cahill is going to be here to talk about Samaritan. So it's really just an opportunity. We don't know what his presentation is yet, but it's just an opportunity for him to connect with our community and for y'all to ask questions. So that'll be the hour before the standard city council meeting. So you're not obligated to go, but you're welcome and you're invited. So we would love to have you.
What time is it again?
5:30,
5:30. Council meeting starts at.
6:30.
So sorry.
Well, I think it's a good opportunity for us as a committee to really think what are the kinds of questions we want to ask Marty, because we've read quite a bit of what Marty's came out in the newspaper publicly and said, but you know, it gives him an opportunity to share his insight, but also answer questions that we may have that go beyond what he's already talked about,
Yep.
you know.
Wanda probably already saw it, but Marty just sent out an email updating what he's doing, what's happening.
If you're not able to attend, is there someone going either from this committee or you or someone on council who would be able to represent some of our questions we might have for
Oh,
us?
yeah.
Okay.
Yeah. If you want to send those to me, I can compile them and then, yeah, either if someone comes, they can ask on behalf or I can make sure your liaison asks. Or,
Okay.
Yeah.
Anything else?
Wow.
That's telling them.
Sorry. You're done. Oh, you're gonna be okay.